Americans are feeling the weight of an unprecedented housing crisis that millions experience, yet few speak about. The quality of this country's housing stock is failing its citizens, specifically 67 million older homeowners. My name is Cameron Carter, CEO and co-founder of Rose, where we are reimagining physical spaces care. Over the past 10 years, I've operated and scaled high-growth healthcare startups serving Medicare Advantage, Medicaid, and commercial members. However, a personal experience drove me to build Rose. In my hometown of Compton, California, my aunt needed help during the pandemic. She is diagnosed with multiple sclerosis and was housebound due to the steps at each entryway of her home. My cousin and I did what any loved one would do and built her a wheelchair ramp so she could enter and exit her home safely. This unique experience motivated me to research other underserved neighborhoods and notice trends in the limitation of senior homeowners to receive and pay for accessible home modifications. Today, only 3% of U.S. owner-occupied housing is accessible, which equates to over 120 million housing units as inaccessible. AARP cites inaccessible housing as a critical healthcare and financial need for seniors. Their latest poll showed over 70% of homeowners 55 years and older already have accessibility issues inside and outside of their homes. Plus, with the median monthly cost for senior housing options ranging between $2,000 and $9,000, many senior homeowners can only afford to age in place in their current housing situation. In-home accessibility is a social determinant of health. When unaddressed, older homeowners and their households are at higher risk for in-home falls, avoidable ER visits, hospitalizations, adverse health events, and higher medical costs. This reality is substantiated as the labor to address this issue is disconnected from the healthcare stakeholders who identify inaccessible housing daily. Rose will be the first ever bridge between the U.S. home improvement industry and the U.S. healthcare system. We established this connection between patient, service providers, and healthcare stakeholders to enable seniors to modify their homes. This ensures the homes meet the physical and social needs of seniors, so individuals can age with dignity, affordably, in a familiar setting. The ability to reduce in-home falls alone would reduce the number one cause of death by injury in individuals 65 years and older. Medical literature indicates accessible home modifications improve both physical and mental health outcomes while lowering total medical costs. Rose is a health tech platform that connects home remodeling companies and occupational therapists to households in need of accessible home modifications at any point in their healthcare journey. The experience on Rose can be described in just 4 steps. Individual homeowners and health plan members can find local service providers through Rose. Master's educated occupational therapists are available to conduct both home safety and physical impairment assessments prior to the home modification. A vetted, licensed home remodeling company will then complete the requested home modification and install any adaptive products or durable medical equipment. The homeowners can pay the home remodeling company directly through Rose, or if insurance or Medicaid is covering the home modification, the home remodeling company can send a claim for reimbursement through Rose. The entire client, OT, contractor, and payer experience can be managed on the Rose platform. The addressable markets Rose will pursue are large and expanding. Rose's initial product is a direct-to-consumer marketplace where the customers are independent home remodeling companies and occupational therapists. Our bottoms-up estimation is that the market size of this marketplace is around $740 million. Now that home modification is a covered benefit for Medicare Advantage, along with Medicaid and the VA, the total eligible beneficiary count is 97 million. With an estimated $3 per member per month capitated payment, we estimate the health plan partnership market to be around $3.5 billion. The long-term vision of Rose is to enter into the home healthcare business, with home modifications as a part of the service offering. To maximize the value of said business model, Rose would then take full financial risk of beneficiaries in a shared savings structure. With a projected Medicare Advantage enrollment at 55 million by 2030, we believe the market size would be around $140 billion. Rose differentiates from its competition like Jukebox Health, ShareCare, because we are integrated into the healthcare ecosystem with aligned incentives to all platform users. Rose will only send skilled labor to conduct home health visits. We will upskill the 500,000 U.S. home remodeling companies to receive reimbursement from private and public health plans. We will structure our health plan partnership to be paid on health outcomes, not by the volume of services. Our go-to-market strategy next year will be to scale our marketplace into 3 states. We will aggregate diverse demand for home modifications through direct outreach to home health agencies, real estate developers, hospitals, and physician groups. monetizing access to that demand through a monthly subscription to independent home remodeling companies and occupational therapists. We will build our brand through SEO marketing, social media content, and industry networking. The brand story of Rose will focus on educating prospective users of Rose to the clinical value of home modifications and the financial options to subsidize the cost of home modifications. This month, Rose launched our first marketplace product into our first major city of Houston, Texas. Additionally, we signed a national partnership with the Living in Place Institute, a subsidiary of the National Kitchen and Bathroom Association, which equips Rose with a network of 2,500 home modification providers. We are in negotiations currently with Allevi Health to bring on their national network of 4,500 occupational therapists onto Rose. We will look to continue Rose's success into 2023. In Q1, we will scale Rose into Dallas and Austin, Texas. In Q2, we will launch Rose into Phoenix and Tucson, Arizona, and plan to execute our first letter of intent with the Medicare Advantage plan for 2024 partnership go-live. We will host continuing education courses throughout 2023 sponsored by the Texas and the Arizona Occupational Therapy Association to educate their members on home modifications for their patients. In Q4, we will launch Rose into Southern California. Rose is led by a world-class leadership team. Its co-founder and chief product officer, Joseph Oconee, has product leadership experience at Google, LinkedIn, Intel, and Lyft. Mike Johnson, Rose's chief technology officer, is a proud U.S. Marine Corps vet and has been a lead platform engineer at TrueCar, Evite, and most recently STTR Collective in Paris, France. I, Cameron Carter, CEO and co-founder, have had value-based care operator experience at Truven Health Analytics, Evelyn Health, Bright Health, and most recently led value-based care growth at DaVita. Thank you for your time in walking through our deck. We sincerely appreciate the support and consideration for the Finalists Award. Thank you.